So my name is Leanne Phillip, and I currently reside and am presenting to you today from the traditional unceded territories of the Lekwungen-speaking peoples, specifically the Esquimalt and Songhees nations. And I just recently completed my practicum with the BC Ministry of Health, where I worked with the Injury Prevention and Healthy Settings team. And this team is situated under the Healthy Living and Health Promotion branch of the Population and Public Health Division. I specifically worked within an area called Healthy Communities. And I'll be speaking with you today about my project, which was to create a healthy community strategic policy framework for the province of BC. So just before I dive in, I just wanted to say a quick thank you to the following. The first is to Dean Murdoch, who is my practicum supervisor and is the provincial lead for the healthy communities at BC Ministry of Health. Also at the Ministry of Health is Heather Wallman, who's a senior policy analyst, and she provided a lot of experience and guidance in helping me put this framework together. And I'd also like to thank Dr. Victoria Barr for her support and answers to many of my questions, as well as Betty Taylor for her work in organizing this placement. So what is BC's Healthy Communities program? And just to back this up even further, and some of you already know, a healthy communities movement has its origins in Canada in the 1980s, and it spread rapidly after the World Health Organization introduced the Healthy Cities program in Europe in 1986. And this was an example of a healthy settings approach that has its roots in the Ottawa Charter for Health Promotion, with a goal to maximize disease prevention using a whole systems approach. The Healthy Communities approach has been adopted in communities throughout Canada and worldwide. So sort of based on that history and premise, the goal of the BC Healthy Communities program is to connect health authorities and communities to work collaboratively on priorities that address the determinants of health and contribute towards health promotion. The objective is to create healthy communities that encourage residents to achieve and maintain their best possible health, utilizing a healthy communities approach. And this program is led by the Ministry of Health, but is done so quite collaboratively and with multiple partners, including the regional health authorities, BC Centre for Disease Control, BC Healthy Communities Society, the Union of BC Municipalities, First Nations Health Authority, and additional ministries in order to stimulate more local actions and policies to support healthy living. All right. So the Healthy Communities program is designed to reconnect the health system, local governments, and First Nation communities through meaningful partnership agreements. And through these partnership agreements, health authorities across the province are able to form and maintain relationships with communities at the local level to support and collaborate on healthy community-focused initiatives and projected outcomes. Joint planning and collaborative work on agreed upon priority actions are expressed in a healthy living strategic plan, and these are formed between communities and their respective health authority. So healthy living strategic plans track the ongoing relationships between health authorities and communities with its terms updated every 1 to 3 years. So these are completely hypothetical examples for you. But for example, Northern Health and say Prince George may want to partner together and form a healthy living strategic plan that prioritizes actions that increases physical activity. Or say Interior Health and Kelowna may want to partner together and create healthy living strategic plans that prioritize actions to improve active transportation. All right, so for my culminating project, I was asked to put together a healthy community strategic policy framework, but what was the purpose in doing so? So first, information about the Healthy Communities program is able to be consolidated into a single resource. It sets a strategic direction for the Healthy Communities program on a broad range of policies that currently govern the actions of it, as well as guide future policy development. It is able to outline future strategic goals and associated strategies and key priorities for the program to achieve. It holds accountability to all partners as each agree to their respective roles and responsibilities, and it assists with building future business cases for further funding or resource approval from the ministry's executive to address local needs. So next, I will speak to the methodology on how Healthy Community Strategic Policy Framework was created. So first, I had an internal consultative meeting to understand what the Ministry of Health was hoping to achieve. To guide this consultative meeting, the ministry developed an initial outline to describe what content and associated expectations were for each section of the framework. Next, an internal review was conducted to understand the Healthy Communities program, ground the framework, and contextualize it. I reviewed the BC's guiding framework for public health that was developed by the Ministry of Health in 2013 and updated in 2017. I think we're all familiar with our coursework that guides the public health system within BC, but more specifically, this Provincial Healthy Communities program. And I also reviewed existing resources, reports, and tools that this program is utilizing currently. I then completed a gray literature search, and this was to provide foundational background context in the value of utilizing a healthy communities approach. And my research question looked to determine what founding concepts and current factors are needed to create healthy communities and improve population health. Sources were trusted by the ministry and were Canadian-based within the last 10 years, and there were exceptions to that for World Health Organization reports. Further research and analysis were completed to define key principles and strategically align this framework to ministry's executives' expectations, as well as to external partners' focuses and initiatives. An initial completed first draft was supported and approved by the Ministry of Health and emailed to all partners for them to review. And then meetings were completed with each of them to further explain the framework, answer any questions they had, and gather their input and feedback. So after taking all those steps, what did the framework actually end up including? So an initial draft framework was completed, as I mentioned, but it did include the partners' feedback, which was incorporated. It had strategic linkages to align with the ministry's executive level goals, objectives, principles and priorities, and performance measures. And it also strategically aligned with their partners' frameworks, toolkits, and action guides and what they're currently working on. It was based on 6 key principles, which included the determinants of health, cultural safety, cultural humility, health equity, and community-based decision-making, as well as health in all policies. It included 4 strategic goals that were predetermined by the ministry, and these included a determinants of health focus, creating effective collaboration, developing cross-government program areas, and pursuing a health in all policies approach. So multiple strategies and key priorities were created, with each partner playing a strategic role. So what implications does this framework have on public health practice? So just for the purpose of this presentation, I've selected 2 strategies and key priority areas created to achieve the framework's goals, although there are multiple of them. So the first strategy is to update the current Healthy Living Strategic Plan template. And again, this plan is developed between health authorities and communities to prioritize items that communities want to focus on to improve health. Currently, the Healthy Living Strategic Plan template has a preset checkbox type selection criteria on what initiatives communities can address. And this strategy focuses on expanding that to from a somewhat narrowed criteria in order to include priority items related to the determinants of health. And by doing this hopefully will provide more flexibility and better enables communities to address needs they are facing, where this template may have been too restricting previously. This could also lead to fostering and expanding relationships between health authorities and communities to address diverse needs that they're facing. This could also increase collaboration between health authorities and a wider range of communities, which can strengthen community engagement and better address health inequities. It creates more of a bottom-up approach versus a top-down approach for communities to better lead initiatives, make decisions, prioritize items, create actions they want to implement and to make their communities healthier. And determinants of health expansion may also highlight possible areas for future healthy public policies to be developed, as health authorities may collectively notice new trends with communities that need to be addressed. The second strategy here was for the Ministry of Health to facilitate a health in all policies approach. And adopting this approach can better address the determinants of health that require interventions outside of the health sector. It can lead to other sectors incorporating health equity into their policies, strategies, and actions, and allows for more collaboration and transparency and accountability to be considered in policy making. And although the initial draft was fairly complete before I left, there are certainly many recommendations just to continue to improve this document and be aware of. And so just to wrap it up, the first is to create a set of actions and timelines to achieve each strategic goal. As it stands now, there aren't any, and this could be a way to monitor and evaluate where strategies are working or not to meet the goals set out in the framework. The second is for the ministry to continue to be aware and cognizant of their partners' capacities, especially if any actionables are included in the framework. They've done a great job so far, but just to continue doing that. And this is especially important as it relates to regional health authorities. As you all know, they're quite consumed with dealing with COVID at the moment. Language, tone, and messaging may have to be updated in other healthy community program materials just to maintain a level of consistency with what the framework is laying out. And as the BC's guiding framework for public health is undergoing an update right now, future goals and associated strategies for the Healthy Communities Framework just should make sure it aligns with this new direction that it provides. And I think I'm at my time, so I'm happy to answer any questions you guys might have.